Have you ever woken up in the middle of the night or first thing in the morning and your mouth feels like the Sahara Desert? You're not alone. Millions of people experience this every single day, and many of them just shrug it off. But here's the thing, that dry, parched feeling in your mouth, your body is actually trying to tell you something. And if you ignore it, it could lead to some serious health issues down the line. Today, we're going to dive deep into why waking up with a dry mouth isn't just an annoying inconvenience. It's your body sending you a message. And I'm going to reveal exactly what that message is, straight from the perspective of medical science. By the end of this video, you'll not only understand what's happening in your body, but also what you can do about it starting tonight. Now, the first thing I want you to know is that a dry mouth in the morning is far more than just a sign that you didn't drink enough water the night before. Sure, dehydration can play a role, but often it's a deeper signal, one that many people overlook because it's subtle or because it seems harmless. You see, our bodies are brilliant communicators. They're constantly sending signals through things like thirst, fatigue, changes in appetite, or even small aches and pains. And a dry mouth is one of those signals. It's your body waving a little red flag and saying, hey, something isn't quite right here. One of the most common causes of waking up with a dry mouth is simply not producing enough saliva while you sleep. Saliva is not just there to make chewing and swallowing easier. It's a vital part of your body's defense system. It helps maintain oral health by washing away bacteria, neutralizing acids, and protecting your teeth and gums. When you don't produce enough saliva, not only do you wake up feeling parched, but your risk for cavities, gum disease, and bad breath goes up significantly. So even though it might seem like a minor inconvenience, your dry mouth could actually be a warning sign for your oral health. Now, let's get into some of the less obvious reasons you might be waking up with a dry mouth. One big one is sleep apnea. If you snore loudly or wake up feeling exhausted even after a full night's sleep, there's a chance that your airway is partially blocked while you sleep, causing your body to breathe through your mouth instead of your nose. Mouth breathing dries out your saliva and leaves you with that desert mouth feeling in the morning. Sleep apnea is not just about snoring. It's a serious condition that can increase your risk of high blood pressure, heart disease, and even stroke if left untreated. So if your dry mouth is accompanied by loud snoring or morning fatigue, this is a huge clue that you need to pay attention. Another reason could be the medications you're taking. A surprisingly large number of prescription and over-the-counter medications list dry mouth as a side effect. Antihistamines, blood pressure medications, antidepressants, and even some painkillers can all reduce saliva production. If you notice a dry mouth creeping in after starting a new medication, it's worth talking to your doctor about alternatives or solutions to manage this side effect. Chronic dehydration is another factor that can't be ignored. Many people think that because they drink water during the day, they're fully hydrated, but it's possible to go into sleep already in a slightly dehydrated state, especially if you've had caffeine or alcohol in the evening. Alcohol, in particular, is a notorious culprit because it's a diuretic, meaning it causes your body to lose more water. Combine that with sleeping in a warm room or under heavy blankets, and your body can wake up seriously parched. But here's where it gets even more interesting. Waking up with a dry mouth can sometimes be a signal of underlying health conditions beyond just dehydration or medication side effects. For example, diabetes can reduce saliva production and cause your mouth to feel dry in the morning. High blood sugar can affect your body's ability to retain fluids, and over time, this can lead to chronic dryness. If you have other symptoms like increased thirst during the day, frequent urination, or unexplained fatigue, a dry mouth might be your body's first clue that something more systemic is going on. Autoimmune conditions are another potential factor. Conditions like Sjogren's syndrome specifically target your body's moisture-producing glands, including the salivary glands. People with this condition often wake up with a severely dry mouth and struggle with dry eyes as well. It's rare, but if you have persistent dryness that doesn't improve with hydration or lifestyle adjustments, it's worth discussing with your doctor. Even lifestyle habits play a major role. Smoking or using nicotine products can drastically reduce saliva production, and sleeping in a position that encourages mouth breathing can exacerbate the problem. Many people don't realize that even things like sleeping with your mouth open due to nasal congestion or allergies can leave you waking up parched. This is why it's so important to look at the big picture, what's going on with your sleep, your hydration, your medications, and your overall health. Now, I want to take a moment to talk about the long-term consequences of ignoring a dry mouth. We often treat it as a minor inconvenience, maybe chewing gum or sipping water in the morning, but if it's persistent, it can lead to serious dental issues. Saliva is the body's natural defense mechanism against bacteria in the mouth. Without enough of it, bacteria multiply, plaque builds up, and your risk for cavities, gum disease, and infections increases significantly. Beyond oral health, a dry mouth can affect your digestion, your ability to taste food, and even your quality of sleep, creating a cycle that can impact your overall well-being. So, what can you do about it? First, start by optimizing your hydration. I'm not just talking about chugging water right before bed. That can actually disrupt your sleep with nighttime bathroom trips. Instead, focus on staying consistently hydrated throughout the day. Water-rich foods like fruits and vegetables can help, and you might want to avoid excessive alcohol or caffeine in the evening. These small adjustments can make a huge difference. Next, look at your sleep environment and habits. If you're a mouth breather, consider using a humidifier in your bedroom, which can add moisture to the air and reduce dryness. Nasal strips or breathing exercises can encourage nasal breathing, which keeps your mouth and throat more hydrated overnight. Even adjusting your sleep position to avoid compressing your airways can help reduce mouth breathing and keep saliva production normal. Oral hygiene is another key factor. Using a toothpaste and mouthwash designed to support saliva production can be very beneficial. There are also special moisturizing gels and sprays available that can help relieve dryness overnight and reduce the risk of oral health issues. And don't forget regular dental checkups. Your dentist can spot early signs of damage caused by chronic dryness and provide personalized solutions. If medications are contributing to your dry mouth, never stop them on your own, but do discuss alternatives or mitigation strategies with your doctor. Sometimes adjusting the dosage or switching medications can make a world of difference. Similarly, if underlying conditions like diabetes or sleep apnea are at play, treating those root causes is essential. Managing blood sugar, using CPAP devices for sleep apnea, or addressing autoimmune conditions can all drastically improve dry mouth symptoms. I also want to highlight the importance of paying attention to your body's signals. Waking up with a dry mouth may seem minor, but it's one of those subtle signs your body gives when something isn't functioning optimally. Over time, ignoring these signals can lead to bigger health issues. Think of your dry mouth as an early warning system. It's much easier to take corrective action now than to deal with complications later. Finally, lifestyle changes can have a huge impact. Quitting smoking, moderating alcohol consumption, eating a balanced diet, and managing stress all contribute to better hydration and overall health. Stress alone can reduce saliva production and contribute to dry mouth, so incorporating mindfulness practices, deep breathing, or relaxation exercises can help. It's amazing how interconnected our habits, environment, and health really are. So if you wake up with a dry mouth, don't just reach for water and forget about it. Take a moment to ask yourself what your body might be trying to tell you. Are you properly hydrated throughout the day? Are you breathing through your mouth at night? Are there medications or underlying health conditions contributing to this symptom? The answers to these questions can reveal a lot about your overall health and help you take steps to prevent bigger issues down the line. And here's the key takeaway. Your body is smart, but it can't always fix everything on its own. A dry mouth in the morning is your body saying, "Pay attention to me." When you listen, adjust your habits, and address underlying issues, you're not just relieving an uncomfortable symptom, you're taking proactive steps to support your oral health, your sleep quality, and your long-term well-being. In conclusion, waking up with a dry mouth is far more than a minor inconvenience. It's a message from your body, a signal that something in your hydration, oral health, lifestyle, or overall health needs attention. By understanding the root causes, from dehydration and medications to sleep apnea and chronic conditions, you can take meaningful action to not only feel better each morning, but also protect your long-term health. Small changes in your habits, sleep environment, and oral care routine can make a profound difference. So don't ignore that dry mouth. Treat it as the wake-up call it really is, and start making adjustments today. Your mouth, your health, and your body as a whole will thank you. Have you ever noticed that no matter how much water you drink or how careful you are about your oral hygiene, your mouth still feels dry every morning or sometimes even throughout the day? That persistent dryness, the kind that seems to stick around no matter what you do, isn't just a minor inconvenience or a sign that you need to drink more water. In fact, your body might be trying to communicate something more serious, something that goes beyond simple dehydration or lifestyle habits, and it's often connected to underlying health conditions that you might not even realize you have. Today, we're going to explore the fascinating and sometimes surprising medical reasons behind chronic dry mouth and why it could be a signal of something like diabetes, autoimmune disorders, or hormonal imbalances, all of which have a profound effect on your overall health, your energy, and even your long-term well-being. When we think about dry mouth, most people immediately assume it's caused by not drinking enough water, staying up too late, or sleeping with their mouth open. While those are certainly factors that can contribute to temporary dryness, persistent dry mouth is different. Persistent dryness is when the sensation of a parched mouth doesn't go away even after proper hydration, improved oral care, and lifestyle adjustments. It's your body sending you a message that something deeper might be going on internally. One of the first conditions that comes to mind when doctors notice persistent dry mouth is diabetes, and there's a very good reason for this. Diabetes affects how your body regulates blood sugar, and elevated blood sugar levels can cause significant changes in the way your body manages fluids. High glucose levels in the blood can draw water out of tissues, leading to dehydration on a cellular level, and this is one of the reasons people with diabetes often experience dry mouth, frequent thirst, and increased urination. When your body is struggling to maintain normal blood sugar levels, it can trigger a cascade of effects, including reduced saliva production. Saliva is more than just water in your mouth. It's a critical component of your body's ability to maintain oral health. It protects your teeth from decay, helps control bacteria, and aids in digestion from the very first bite of food. When saliva production drops, your mouth is not only uncomfortable, but it's also more vulnerable to infections, cavities, and gum disease. This is why persistent dry mouth in a person who has other subtle symptoms like feeling unusually thirsty, experiencing fatigue, or noticing blurred vision can be one of the first clues that diabetes might be developing or already present. Early recognition is key because controlling blood sugar not only improves dryness, but also prevents long-term complications associated with diabetes. Another category of conditions that can cause persistent dry mouth is autoimmune disorders, particularly those that affect your moisture-producing glands. One of the most well-known of these is Sjogren's syndrome, a condition in which the immune system mistakenly attacks the glands responsible for producing saliva and tears. People with Sjogren's syndrome often experience not only chronic dry mouth, but also dry eyes, difficulty swallowing, and sometimes swelling or tenderness in the salivary glands. The dryness in these cases isn't just uncomfortable, it can lead to complications like oral infections, difficulty speaking, and problems with digestion because saliva is essential for breaking down food before it reaches the stomach. Autoimmune-related dryness can also be accompanied by fatigue, joint pain, or other systemic symptoms, which is why it's important to pay attention to your body's signals and consult a healthcare provider if these symptoms persist. Hormonal imbalances are another often overlooked contributor to chronic dry mouth. Hormones regulate many aspects of bodily function, including fluid balance, metabolism, and tissue hydration. For example, changes in sex hormones like estrogen and testosterone, which naturally fluctuate during menopause, andropause, or certain endocrine disorders, can affect saliva production and overall oral moisture. Women in particular may notice increased dryness during menopause when estrogen levels drop, because estrogen plays a role in maintaining the health of oral tissues. Similarly, thyroid disorders, which alter metabolism and hormone levels, can indirectly affect the salivary glands and lead to persistent dryness. Even stress hormones like cortisol, which rise when the body is under chronic stress, can reduce saliva production and contribute to that uncomfortable, parched sensation that just doesn't seem to go away. It's also worth noting that persistent dryness is not always caused by just one underlying factor. It's often a combination of conditions that interact in complex ways. For instance, a person might have mild diabetes that isn't yet diagnosed, a thyroid imbalance, and be under chronic stress, all of which can compound the effects on saliva production. Lifestyle factors can exacerbate the situation as well. Smoking, excessive caffeine, alcohol consumption, and even certain medications can further reduce saliva flow, creating a cycle where dryness perpetuates itself. Understanding that persistent dry mouth can be multifactorial is essential, because it underscores the importance of taking a comprehensive look at your health rather than just treating the symptom superficially. When chronic dryness persists, one of the first steps a healthcare provider might take is to evaluate your blood sugar and perform a basic metabolic panel. Checking for diabetes or prediabetes is crucial, because addressing blood sugar imbalances early can reverse or reduce many of the symptoms, including dryness. Doctors might also evaluate autoimmune markers or hormone levels to look for conditions like Sjogren's syndrome, thyroid disorders, or hormonal deficiencies that could be contributing to the problem. The earlier these conditions are identified, the sooner interventions can be put in place to restore oral moisture, improve comfort, and prevent long-term complications. While persistent dryness may feel like a minor annoyance, its implications are far-reaching. For instance, oral infections caused by chronic lack of saliva can spread to other parts of the body and trigger systemic inflammation. Digestive issues can develop because saliva is the first step in breaking down food, and without it, your body may struggle to absorb nutrients efficiently. Sleep can also be affected. Dryness at night may lead to snoring or even exacerbate sleep apnea, creating a cycle of poor rest and increased dryness. By taking persistent dry mouth seriously, you're not just addressing a small symptom, you're protecting your overall health and quality of life. There are practical steps you can take at home to manage dryness while you investigate potential underlying causes. Staying well hydrated throughout the day is essential, but hydration alone may not resolve the issue if an underlying condition is present. Using sugar-free chewing gum or lozenges can stimulate saliva production temporarily, and moisturizing mouth rinses or gels can provide relief, especially overnight. Adjusting your sleep environment, like using a humidifier or avoiding sleeping with your mouth open, can also help reduce dryness. However, these measures are supportive. They don't replace medical evaluation when persistent dryness is signaling deeper health issues. Understanding the connection between persistent dryness and health conditions like diabetes, autoimmune disorders, or hormonal imbalances can also help you take a proactive approach to your overall well-being. Monitoring for other subtle symptoms like unexplained fatigue, changes in appetite, joint pain, mood swings, or frequent urination can provide valuable clues about what's going on internally. Keeping a log of your symptoms, hydration habits, medications, and lifestyle factors can help both you and your healthcare provider identify patterns and address root causes more effectively. When it comes to autoimmune conditions, it's important to recognize that chronic dryness is often just one piece of a larger puzzle. Conditions like Sjogren's syndrome, lupus, or rheumatoid arthritis may also present with joint pain, skin changes, or general fatigue. These conditions require careful management with the guidance of a healthcare provider, and addressing dry mouth is often part of a broader treatment plan. Moisture replacement, dietary adjustments, and sometimes medications to stimulate saliva production are common strategies that can significantly improve quality of life. Hormonal imbalances, especially those related to thyroid dysfunction or reproductive hormones, can be more subtle but equally impactful. Dry mouth may be accompanied by changes in energy, weight, mood, or sleep patterns. Working with a healthcare provider to check hormone levels and correct imbalances can not only alleviate dryness, but also improve many other aspects of health. For women, menopause-related dryness may be managed with localized treatments or lifestyle adjustments, while men experiencing low testosterone might benefit from targeted interventions. Persistent dryness is also a signal that your oral health may need more attention. Without sufficient saliva, the natural cleansing process in your mouth is compromised. Plaque can accumulate more easily, enamel can wear down faster, and the risk of gum disease increases. Regular dental visits, along with using specialized toothpaste and mouth rinses that support moisture and oral health, are key components in managing long-term dryness and preventing complications. The psychological impact of persistent dryness shouldn't be overlooked either. Chronic discomfort can affect your confidence, your appetite, and even your social interactions. Imagine trying to speak clearly or eat comfortably when your mouth feels parched every day. This is why addressing dryness isn't just about physical health, it's also about maintaining quality of life and emotional well-being. By recognizing that persistent dryness may be linked to systemic health issues, you empower yourself to take action that improves both your comfort and your long-term health outcomes. It's also important to be aware that persistent dryness can sometimes indicate multiple overlapping conditions. For example, someone with prediabetes who is also undergoing menopause might experience compounded dryness due to both elevated blood sugar and hormonal changes. In such cases, a comprehensive approach that addresses both underlying causes simultaneously is the most effective strategy. This may include medical interventions, lifestyle adjustments, and targeted oral care practices. Education is a powerful tool when it comes to persistent dryness. Understanding that your body is signaling a potential health issue helps you take the symptoms seriously rather than dismissing them as minor annoyances. It encourages proactive discussions with healthcare providers, early detection of conditions like diabetes or autoimmune disorders, and timely interventions that can prevent more serious complications in the future. Additionally, lifestyle factors play an undeniable role. Reducing alcohol intake, quitting smoking, managing stress, and ensuring balanced nutrition all contribute to better hydration, healthier salivary function, and overall wellness. Stress in particular can increase cortisol levels, which suppress saliva production and exacerbate dryness. Incorporating mindfulness practices, deep breathing, and regular physical activity can support both hormonal balance and oral health, creating a holistic approach to managing persistent dryness. Finally, recognizing the connection between chronic dryness and systemic health conditions is empowering. It shifts the perspective from treating a surface-level symptom to addressing the root cause. Whether it's diabetes, an autoimmune disorder, hormonal changes, or a combination of factors, understanding that your body is giving you an important signal allows you to act, make informed health decisions, and ultimately improve your overall well-being in a sustainable way.